Have you ever looked at a single, isolated bone and wondered how anyone could tell which side it belongs to? Easy hack. Sternal end to the midline. The S-curve bows forward medially, and the smooth surface faces up. Left, right. Then we will map every muscle attachment. The clavicle, commonly called the collarbone, often stumps students. This slender S-shaped bone is a masterpiece of design. It acts as a strut connecting the arm to the rest of the skeleton. Unlocking its secrets is easier than you think. We will first teach an easy hack to determine side, left, right, then we will map every muscle attachment. This is your roadmap to mastering the clavicle. First, fundamental rules for side determination, distinct shapes of its two ends, the curvature of its shaft, then a detailed tour of its surfaces. Determining whether a clavicle belongs to the left or right side of the body can be accomplished with a few simple observations. The first and most crucial step is to identify the two ends. One end is thick, somewhat quadrangular or rounded, and is called the sternal end. It articulates with the sternum, the breastbone. The other end is markedly flattened from top to bottom, known as the acromial end. It connects with the acromion process of the scapula, the shoulder blade. The rule is simple. The large, rounded sternal end always points toward the midline of the body, while the flat, wide acromial end always points out toward the shoulder. Once you have the ends figured out, the next clue is the bone's distinctive S shape. To see this properly, you must view the clavicle from above, as if you were looking down at your own shoulders. Top-down view of left and right clavicle, highlighting S-curve and medial lateral ends. The medial 2/3 of the bone curves forward anteriorly. The lateral 1/3 curves backward posteriorly. So, when you lay the clavicle on a flat surface, orient it so the big, round sternal end is medial and the flatter acromial end is lateral. The forward bow of the medial part should be pointing toward the front, just like your own collarbones curve forward from your chest. This double check of the curvature is a foolproof way to confirm its orientation. The third step involves examining the surfaces. The clavicle has a superior top surface and an inferior bottom surface. The superior surface, which lies just beneath the skin, is relatively smooth and featureless. In contrast, the inferior surface is rough and marked by grooves and ridges for the attachment of strong ligaments and a muscle. The key landmark on the inferior surface is a distinct groove located in the middle third of the shaft, called the subclavian groove. This groove always faces downward. Therefore, the smooth side faces up and the rough side with the groove faces down. By combining these three simple rules, siding the clavicle becomes an easy task. First, place the bone so the rounded sternal end is medial and the flat acromial end is lateral. Second, rotate it so the prominent forward curve in the medial section is pointing anteriorly. Finally, confirm the smoother surface is facing superiorly up and the rougher surface with the groove facing inferiorly down. Now that we can correctly orient the clavicle, let's map the muscles attached to its superior surface. We'll look at the anterior border and the posterior border. 4 major muscles attach here: pectoralis major, deltoid, sternocleidomastoid, SCM, trapezius. The front and back of the clavicle serve as anchors for the chest, the shoulder, the neck. Visualize these connections. The clavicle acts as a lever arm, from shrugging your shoulders to lifting your arm overhead. Pectoralis major, large chest muscle attaching to the clavicle. The clavicular head originates from the anterior surface of the medial half. Feel your collarbone and trace this from the sternum to about the midpoint of the bone. This portion flexes the arm and lifts it forward and adducts it across the chest. The attachment is a broad, fleshy origin with a subtle texture on the bone. Moving laterally along the anterior surface, the deltoid appears. Anterior deltoid fibers form the rounded shoulder contour. They originate from the anterior border of the lateral 1/3 of the clavicle. This sits right next to where the pectoralis ends. Pectoralis pulls across the body. The anterior deltoid lifts the arm forward. Those opposing front-facing fibers show the clavicle's anchor roll. Flip to the posterior border. Two more attachments. Medial posterior, sternocleidomastoid. The SCM runs up the side of the neck to the skull. Its clavicular head comes from a small, rough impression on the medial third. SCM turns the head to the opposite side and flexes the neck. Lateral posterior, trapezius insertion. Trapezius, massive diamond-shaped upper back muscle. Its descending fibers insert on the posterior border of the lateral one-third. Trapezius elevates the shoulder girdle. You use it to shrug. Notice the symmetry. Deltoid front, trapezius back. Together, a muscular V. So yeah, that's the superior map. The inferior surface of the clavicle, while hidden from view, is a bustling hub of activity, providing secure anchor points for a crucial muscle and several powerful ligaments that stabilize the shoulder joint. Unlike the relatively smooth superior surface, this underside is marked by specific rough patches, tubercles, and a prominent groove. These features are not random. They are purpose-built structures designed to withstand immense tensile forces. The most obvious feature on the inferior surface is the subclavian groove, a longitudinal depression running along the middle third of the shaft. This groove is the home of the subclavius muscle. The name subclavius literally means under the clavicle. This small muscle originates from the first rib and inserts into this groove. It acts as a cushion, protecting the major subclavian blood vessels and the brachial plexus. It also serves to depress the clavicle and anchor it against the rib cage. Moving toward the medial sternal end, you will find a distinct rough impression known as the costoclavicular ligament impression. This oval-shaped area is the attachment site for the incredibly strong costoclavicular ligament, a primary stabilizer of the sternoclavicular joint. It prevents excessive elevation of the clavicle, anchoring the shoulder girdle during lifting. Traveling to the lateral acromial end, we find two more landmarks: the conoid tubercle and the trapezoid line. The conoid tubercle is a prominent bony bump on the posterior aspect near the acromial end. Just lateral to it is the trapezoid line, a subtle ridge that extends forward and outward. These serve as the attachment points for the two parts of the coracoclavicular ligament, conoid and trapezoid, suspending the scapula and the arm from the clavicle. Together, the subclavius muscle and these powerful ligaments make the inferior surface a fortress of stability. The subclavian groove houses the protective subclavius. Medially, the costoclavicular ligament impression. Laterally, the conoid tubercle and trapezoid line securing the clavicle to the scapula. In summary, the clavicle, or collarbone, is far more than a simple strut. Its S-shape, distinct ends, and varied surfaces provide mobility and stability to the upper limb. 3 rules to determine side. Round sternal end points medially. S-curve bows forward. Smooth surface faces superiorly. Follow this sequence and you can identify left versus right confidently. We mapped muscular and ligamentous attachments. Elegant biomechanical design. Pectoralis major. Anterior deltoid. Sternocleidomastoid, trapezius, subclavius, costoclavicular ligament, coracoclavicular ligament. Bumps, grooves, rough patches tell the story of forces and movement. Who needs this? Students learning anatomy, clinicians diagnosing shoulder pain, surgeons repairing fractures, physical therapists rehabbing injuries. The location of a fracture can show which muscle functions are compromised, guiding a targeted recovery plan. Think of the clavicle as a key. The thick, round sternal end is the bow. The flat, lateral acromial end is the blade. The tooth, the ligaments and subclavian groove, must point down. Hold the bow to your midline and the tooth down, and it will lay on the correct side, unlocking a clear, lasting understanding. And well, that's the whole picture.